Hello, I'm Dr. Maurie Markman from City of Hope, and I'd like to discuss a very interesting paper um, recently reported in JAMA Internal Medicine entitled Lung Cancer Screening in the United States 2022. Before I begin, a little bit of an alert. This is not a positive report. In fact, it's quite discouraging. So, what this group did, in fact, was look at population patients who were eligible to receive low dose CT scanning, screening for lung cancer, as has been demonstrated very clearly, unquestionably, to be of value, and recommended by the U.S. Preventative Services Task Force, specifically on high risk individuals aged 50 to 80 who had a history of 20 or more pack years of smoking, um, either currently smoking still or who had quit less than 15 years prior to the current date. Those are the recommendations. The data demonstrates the ability to find early stage disease, cure disease, lung cancer. What this group did was looked at the data from a cross-sectional database, looking at the 2022 Behavioral Risk Factor Surveillance System. It's a nationwide state representative survey of individuals who were aged 50 to 79. This was self-reported data. But the bottom line here was, overall, only 18%, that's less than 1 out of 5 individuals who were eligible, in fact, had undergone low-dose CT scan screening. This is a strategy which is safe, but insurance companies, CMS would pay for because it's been approved by the task force, been shown to be benefit. But in the country, in this evaluation, only 18% of patients have undergone this. There are obviously a variety of reasons for this, but we really have to ask the question, why? We have a test that is of demonstrated value, a test that is shown to save lives, a test that can lead to an effective therapy, surgery, that can be curative, and yet only 1 out of 5 individuals take advantage of it. We have to ask the question, what is happening in this country to have this be the case, and what can we do to make a difference? Very difficult question, but I would argue it's a very important societal question to ask for a number of screening strategies, but this one in particular, because the morbidity of treatment for lung cancer is tremendous, the cost of the treatment and the mortality is extremely high in advanced disease. And I thank you for your attention.